Hello and welcome, Dr. Morgan, to the Rev Up Health podcast.
Well, thank you so much for having me. I'm excited to be here today.
Yeah, so we are so excited to hear about your new hair restoration program. And our first question is, what inspired you to kind of look at this?
Well, I've had my own journey with hair, but nothing's too dramatic. But almost every one of my patients complain about their hair, men and women. Men just tend to kind of roll with it a little bit better. I think yeah. Not all of them, though. Some of them get a little upset about it. But as women, it is really a big part of our identity almost. And so it's really scary when you start to lose it. And that can be really scary. So that was really just one of the main motivations was if there's something out there that I could add to what I already do with patients that would really make a difference in their hair, then I know people will be happy about that.
Yes, that is so true. So, are there certain kinds of patients that are really good candidates or certain concerns that this program is designed for?
Yeah, it's really designed for just about anyone on any journey with their hair. I was talking to a patient just the other day and she said, "Well, I'm not really losing my hair, but it's just not, it's always been super thin and a kind of poor quality, but I'm not shedding a lot like I hear from other people." And she's a great candidate too. Like we can all have healthier hair. Now, I'm sure there are a few people out there that I can kind of picture right now that I would say, no, you don't need this. But anybody that wants to improve their hair can. And that's really exciting. That is one of the biggest takeaways I had from my one-on-one training was that it is possible to improve your hair for anyone, even if it's dramatic. It can really be improved. The health of your scalp, the health of your hair, there's room for improvement for all of us.
Yeah, there's a lot of myths out there too that just float around. It's just like a virus, on social media. So
Yeah.
maybe we can kind of talk about some things like along that line about what myths are out there potentially that are misconceptions that maybe
Yeah.
you've heard.
Yes, for sure. And I was blown away when I learned some of these things. One of my favorite things to share with people is that a lot of, I think that there are some social media messages out there that say you shouldn't wash your hair very often and as little as possible to kind of keep the hair that you have. And that's absolutely not true. Your scalp will grow healthier hair when it's clean. And so we want to wash every day or every other day. Now, for black and, ethnic, real coarse hair, probably twice a week would be the most you'd want to do. But I know a lot of people who really only wash in that community wash maybe once every 2 weeks. So the cleaner the scalp, the healthier the hair, which was really kind of reassuring. And one of the things that makes all the sense in the world to me, because, when people think about washing their hair, they're going to cause, some trauma and the hair's going to fall out more and you're going to see it in your drain or in your hairbrush. Interestingly, that hair that falls out, which is very normal, it's normal to lose up to 100 hairs a day. But that hair that falls out when we're washing actually detached from the root about 8 to 12 weeks prior to falling out. So it's a slow migration. That hair follicle is deep in our scalp. And people just that's a big misconception that trauma is causing your hair to fall out. So
Yeah.
I was very reassured by that. And maybe you knew that, Mark, as an ENT, but I didn't know that.
That's interesting. No, I didn't realize it was that far, that long actually before it would detach. So,
Yeah.
and of course, then we heard about the issues with, okay, is it genetic or, my father or my mother had problems with
Mhm.
their hair loss. And does that mean that I'm going to have hair loss? Is that something also that's typical or is it difference between male and females?
Well, there are differences between male and females and where we lose. So let's talk about that first. And then if I forget, remind me to come back to the other part of that question. So women typically genetically will lose across the top of their hair and kind of a widening of the part. So we call that a Christmas tree. If you look at it directly on top, the widest part is usually at the back and then it narrows down. But they usually will lose here. And a lot of us can probably picture what that looks like. You're standing outside, you're talking to somebody, and the sunlight's coming through, and you're like, wow, I can see the top of her scalp. Whereas men will then tend to lose in the temple area and at the crown. And so the patterns for male and female are different. Now, women that are on too much testosterone or very sensitive to the hair effects of testosterone will start to get that male pattern coming through the temples. So women on hormone therapy can have male patterned thinning, but mostly it's women lose across the part and men lose from the back and from the front. And then eventually those things join. And we see that. We see that with men who then have hair through here when they go kind of completely bald. Most of the time, they still have hair growth down low. So, genetic factors, everyone has genetic hair loss. So, your parents may have really healthy hair, but their parents may not have. So, we don't know how that penetrates through the genes, but likely all of our garden variety hair thinning is a genetic hair loss. So the good news is that all of that can be prevented if we start early enough. And one of my favorite misconceptions is that women never lose the ability to grow hair. So men, once they really let it go and they are what we call slick, shiny bald, and we can picture that, what that looks like. It's really slick and shiny. That hair follicle is gone. You're not going to grow hair in that spot. Now you can recover hair around it, which then will make you look like you have a fuller head of hair.
Lower, yes.
Yeah. We want a healthy comb over. But for women, even those women that look really bald through here, those follicles never go dormant, and you can wake them up with the right treatment. So that's really reassuring.
Yeah, it's cool. Really reassuring. So, what other things can cause people to lose hair as far as stress, hormones, diet, gut
Yeah.
health? Or are there other things that can help?
So this is an interesting thing, and something that I learned from this too is that 95% of hair loss that's dramatic and that people really worry about is genetic. And whether, again, we don't know how those genes penetrate. So it may not be that your parents had it and you have it, but it is a genetic component. And basically what that is, your genetic predisposition to be sensitive to DHT. So DHT is the breakdown product of estrogen and testosterone. And not just for people that take those hormones, but in our own natural state, we metabolize those hormones to DHT, and DHT causes vasoconstriction, or help me out, vasoconstriction or narrowing of the blood vessels at that hair follicle. So decreased blood flow is what I'm trying to say. Yeah. So decreased blood flow at the hair follicle down deep in the scalp will cause a thinner, more fragile hair that is more prone to detaching and thinning. So that's the genetic component, and that's 95% of hair loss. So there are a few conditions that people will lose, but they're pretty specific. Sometimes you can get a fungal infection in the scalp, and that is something that's pretty patchy. And so it's not the typical genetic pattern. It's losing chunks of hair in various spots. So that's pretty easy to figure out. And then the good news is that when we do these shedding things, and shedding is something that happens, it actually happens about every 3 months, whether even in a very healthy state. Like I said, it's normal to lose about 100 hairs a day, but we will sometimes lose more than that. And then sometimes we'll lose less. And that usually runs in about a 3-month cycle from anogenic to a telogenic phase where we grow and then we lose. And so that's very normal. But when we have stress, or when we're, say, taking GLP-1 or anesthesia, can cause a lot of hair loss. So big stressors in our lives, both physically and mentally, will then increase the length of that telogenic phase where we're losing more. And so that is hair that is going to recover. You will go back into a growth phase at some point. And so when we're shedding, like a shock, I call it a shock shedding. So it's like, oh my gosh, how am I losing all this hair? We cannot panic because it will recover. And there's ways to speed that process along, but it's not a permanent hair loss.
That's really good to know.
It's reassuring. Yeah.
It is, yes.
I think you can understand now why people maybe they have this chronic stress in their lives, and that doesn't affects all kinds of things. I mean, some way you can certainly see where it could cause a kind of a chronic thinning, if you will, that hair too. So
Yeah.
So, are there any common hair practices that people do that that they may think they're helping, but they're actually damaging their hair?
Not a lot, actually. Well, actually, keratin products, when you see products, maybe, serums or creams, styling creams that have the word keratin or protein in it, you probably actually want to avoid those. You could use them in like a keratin treatment sometimes people get. I've gotten them before, and that infuses protein back into the hair shaft and makes it less prone to frizz. But if you were to use those things too often, you're going to create a lot of buildup and you're not really helping the health of your hair at all. So the health of our hair comes from the root. And so finding things that increase that blood flow and nutrients that are important for growing or making collagen are where we want to focus our efforts. So don't overuse keratin products. We definitely want to wash our hair frequently, like we talked about. So at least every other day, if not every day. But then we also want to wash in a way where we wash twice. I used to always believe that when you read on the back of a shampoo bottle, that says wash, rinse, repeat, I always thought, well, that's just a gimmick to get you to use more shampoo, but it's not. So it really cleans our scalp really well, takes away the oils, and then we always want to condition and add back those oils. So maybe not a heavy hair mask every time, but a lot of people think, oh, I don't want to condition my scalp because it makes my hair greasy. And that's probably because they're not washing enough. But introducing that conditioner back on after you've washed twice with shampoo is a good thing. I did find that coloring your hair is not really all that damaging. Now, really harsh colors, like really bleach, heavy bleached kind of processes can be harmful. But overall, it's not going to contribute to your hair loss or your shedding, which is great.
Okay.
And then, of course, sometimes ethnic hair, especially when we're doing a lot of traction or braiding, that can actually cause some traction loss. So traction loss just from brushing your hair is not a real thing, but traction from really pulling hard to get your hair to mold into a certain style could be damaging.
Yeah. And of course, what comes to my mind with that are, maybe some of the athletes, just specifically, you see the girls in softball, you see the girls in soccer that have got the hair bands that are always wearing those. They're always having the traction on their hair. So it makes me wonder, it's like, what is that really doing to their hair and to their scalp? So I think it's more of a recession thing, obviously, it sounds like. So, but interesting. Yeah. So, I mean, what do you think about root causes of nutritional hair improvement? Or we can do key nutrients maybe that we want to look at, or someone that can maybe start to begin to think, well, I need to get this in my diet or I need to get that in my diet.
Absolutely. That's a good question. And that was something else that I was kind of surprised by. I've prescribed a certain type of hair vitamin similar to Nutrafol for lots and lots of my patients, and they've done pretty well on it. It's not that it's not helpful, but you probably don't need a big gun like that has a lot of different things in it, to throw at your hair loss issues. So labs are important. So specifically the labs that we really want to make sure of, one, thyroid health, hormone health, those go without saying. Those are really important to look at. But specifically for nutrients, copper, zinc, ferritin, and vitamin D are the biggest things that we want to make sure we've dialed in just right to make sure we're promoting hair growth. So that was kind of surprising to me. I learned that most people are not deficient in biotin. So biotin is one of those things that we hear a lot about. We think it's really important for collagen production, for hair and skin and nails. And it is to a certain extent, but most people aren't deficient in it. And sometimes it can actually cause acne. So that can be a frustrating thing. Yeah.
Yeah, and that's actually kind of good to know. We try to let our patients know to not take biotin because it can kind of offset some of their other markers,
Yeah.
when we're
Those
getting
thyroid
results. So, yeah. Are there specific levels of vitamin D and the copper and zinc that you're looking for?
Yeah. The copper and zinc. Let me get my cheat sheet out. Because I just kind of came back from this training and I'm just loving it, gaining all this knowledge. The vitamin D, you want at least 60 to 80 is what we're looking for. And I did specifically ask the trainer about, well, what if it's 100? Sometimes I like my patients to be right around 100. So there's nothing wrong with it being a little over, but we want minimum of 60 on that. The ferritin really about 60 to 100, so similar to the vitamin D. And then copper, ideally for hair growth, would be 84 to 126. Very specific range there. Yeah. So
That's not something we typically see drawn.
no. Yeah. So I've started adding it. It's not expensive to add. So I think Tandy, you and I looked that up the other day, but they weren't too pricey to add copper and zinc to the normal testing I do. And I usually I'm getting a lot of vitamin D and most of the time getting a ferritin too. So those are the places to really concentrate on. And then if you're not really deficient in those areas, you don't need to be taking a dedicated supplement for it. So it may really cut down on the amount of supplements we're asking patients to take.
Cost, yeah, because there's so
yeah.
tons of,
And the cost.
but coming in with just multiple supplements.
Yeah.
But what are you
Yeah.
trying to treat? Are you efficient or are you trying to be super physiologic? So yeah,
Yeah.
it varies there a lot.
Yeah.
Comes some of the other treatment modalities we've heard, there's PRP, platelet-rich plasma, peptide therapies. Of course, there's hormone optimizations. Is there any comment about any of those that you think
Well,
more important than others? Or there's a lot of studies and research needing to be done still to kind of confirm a lot of this. And, you can just about get any answer you want trying to find the right study, of course. So,
that's right.
or is it something that in the long run that's going to make a difference for people?
I think so. So it could be a combination of things. And so this is where seeking out the consultation of someone who's trained in hair recovery. I like to call it hair recovery because I think we can all recover the health of our hair. So it may be different for each person. So exosome therapy, PRP, kind of similar. They're both injected into the scalp. You can do some microneedling there. A lot of people heard of microneedling for your face to kind of build that collagen, but microneedling in the scalp and then injection of PRP and that kind of thing can be really helpful if you have a bare spot, right? If it's pretty dramatic. If it's just overall thinning, that may not be the best answer. And none of it is going to be harmful, but where do you want to spend your dollars? The problem with this is that it's super expensive. I mean, anything you look at is, an investment and it may be worth investing in, but you really want to kind of custom tailor a program for that patient's specific needs. So one of the key takeaways that I learned about was medical grade laser for the hair. And I do believe that is a modality that is important for every part of a hair recovery program. So I really believe that a lot of people could be helped with the medical grade laser and maybe some topical minoxidil, finasteride, even some oral medications. There are pharmaceutical answers for hair growth, but we really want to combine at least every combination of things that I may come up with for a patient is going to involve that medical grade laser. And I'm pretty excited about it. It's a cap that you wear really just 6 minutes a day, and you don't need to wear it longer. It's not more is better. Just 6 minutes a day is all you need. It's kind of like a baseball cap. You can do it while you're, brushing your teeth or sitting and meditating or whatever it might be. The nice thing is it's only 6 minutes, but it is important for your hair health moving forward. And really, they suggest that you use it for a lifetime. The devices that I am going to be using with my patients have a 10-year warranty. And so, it's something that you want to add into your daily health routine. But it seems like a big piece of the puzzle when it comes to really growing that hair. And it's different. The medical grade laser is different than like a red light therapy. You see a lot of red light out there right now, which can be really beneficial. But I like to explain the red light as like a street light, street lamp in a dark parking lot. So that light comes out and it's just really diffuse. By the time it hits the ground, you can't quite see where the light was, where the dark was. It's just diffuse light. And so that can be really helpful for scalp conditions and for wrinkles and things that are on the surface. But what we want to do is affect that blood flow to that hair follicle, which again is deep in the scalp. So when we use a medical grade laser, it really penetrates much, much deeper and it hits the level of scalp that we want. And so it's a lot more effective than a red light cap.
Okay.
Yeah.
Yeah.
Sounds good. So yeah, it's really more about increasing the blood flow and stimulating the scalp.
Exactly. Exactly. And that's why like finasteride works well. Finasteride is a DHT blocker. So it blocks the conversion of estradiol and testosterone to DHT, which is what causes the vasoconstriction of the blood flow to the scalp. So we can affect that by decreasing the amount of DHT you have with those pharmaceutical options. But then we also want to turn on the hose. We want to turn on the irrigation to that hair follicle. And so using both can be really beneficial. But it'll be up to, I think each patient is going to be kind of have not a one size fits all approach, but to have a customized approach to what each patient might need.
Yeah.
And some people may just need a few things.
Yeah, that's awesome. What kind of a timeline would patients expect with say the laser or the laser in combination with something else? When will they notice a difference in their hair?
Yeah, usually within about 90 days, you're noticing a pretty big difference. And within 6 months, you really, especially if you're compliant. I mean, that's one of the big things is you have to be compliant with using the laser and doing all the other things. But within 90 days for sure, you're going to see some improvement. And then you're not going to see maximum improvement for about 2 years. So the good news is as much as some of these before and afters that I've seen with this combination of treatment are super impressive, the good news is it just keeps getting better. So continued use keeps making it healthier and healthier. And then you use that to keep everything,
Awesome. So I think another thing to talk about as I was thinking about seeing improvements, there's also like a microscopic camera that you use, right? To
Yes.
see what it looks like down there.
Yes, I can't wait to get it. I've ordered it. It's not here yet, but I've trained on it and it is really fascinating. It's basically, this is my lip balm, but it's not too much bigger than this, but you take certain pictures in different parts of the hair or the scalp, and then you can really truly see the difference between a healthy hair and an unhealthy hair. You can see a variety of issues with the scalp that may need to be addressed that you could never see with the naked eye. So it's really fascinating. It's a little creepy, like when you get these pictures back. I was so naive. I thought, well, I'm kind of healthy scalp. And so they took pictures and I look at my pictures and I was like, oh my gosh, it's like a alien. That was really weird. Expected a little flea to be jumping through there or something. It was funny, but it really is fascinating that the more and more you look at those scalp pictures, the more you can identify certain issues, especially like the non-washing enough, because that really does show some buildup on the scalp that you would never notice otherwise.
Yeah. So, what is your message for someone feeling discouraged by hair loss, especially if they've tried everything?
Well, again, I came out of this training with so much optimism for what's possible. And I think the problem when people have tried something and it hasn't seemed to work is that it's a monotherapy. They're trying one thing. And I really think it's the combination of things, looking at those labs, using that medical grade laser cap with or without prescriptions, good hair hygiene, all of it really should allow you to improve your hair. I won't be able to make promises, but I am really optimistic. And Tandi, you know me well. Like if I wasn't super sure about this whole process, then I would not feel comfortable with the idea of offering it to my patients. So I am just thrilled to be able to have something that I'm so confident in. And that was one of those big takeaways that I got was that especially for women, we never lose the ability to grow hair. That hair follicle may be dormant, but we can wake it up. And so it's really reassuring.
Yeah. So, it's never too late.
Never too late. Yeah. Well,
Mhm.
slick, shiny, bald. We don't want people to spend a bunch of money on, treating men. And again, it's just for men that process happens. But there's a few patients I can think of that my dad, for instance, I'm not doing this with my dad. He's been slick, shiny, bald for most of his life. So,
As long as he has a cap on,
yeah,
he goes up.
yeah. That's right. That's right. But otherwise, for sure, there's room for improvement.
Yeah. So, what are the next steps if somebody wants to get started? What do they do?
Wow.
How do they find you?
Yeah, good question. I don't know yet. No, I'm working on that. I am working on that. Actually, on my Instagram, if someone wanted to just DM the word hair, I'm putting all of those people on a newsletter list. And so will be able to get out a newsletter soon. This should be up and running by June 1. So, like I said, I just got done with the training and came back with all this knowledge. I'm so excited about it, but I really want to get all my ducks in a row so that I can roll it out and someone will have a seamless kind of recovery process.
Excellent. Well,
Nice.
I love that. I'm super excited to see pictures and try it out myself.
Well, we really appreciate your time. It's been nice of you to take time out of your schedule to meet with us to talk about hair. So I hope that individuals, they have questions, they can reach out to us, but we'll certainly keep all this in mind. So
Absolutely. I'm excited about it too. Thank you guys. Good to see you.
have a great day. Thanks.
Thanks.